Welcome to my week 3 industrial training vlog here in Surabaya, Indonesia. For this week, the most significant clinical experience I had was getting the opportunity to be an operator for a CT scan. During this week, I was able to gain more hands-on experience with the CT workflow. I learned how to perform the topogram, determine the appropriate timing for the test bolus, prepare and administer contrast, and communicate with the patient throughout the examination. One of the biggest challenges I faced was the language barrier. Most of the patients here speak Japanese, which I do not understand very well. However, the radiographers and staff were very helpful. When I had difficulty understanding, they would explain things to me in Indonesian and try their best to make sure I understood. This experience was important to me because it helped strengthen my practical skills and confidence. Being able to experience the actual workflow in a hospital made me realize that clinical practice requires not only technical knowledge, but also communication, decision-making, and adaptability. The most interesting part this week was the difference between theory and clinical practice. In class, I learned that for a CT abdomen contrast examination, the routine protocol involved 3 types of contrast, which is oral contrast, intravenous contrast, and rectal contrast, which the patient would usually be given oral contrast to drink, IV contrast would be administered through the intravenous line, and rectal contrast would be introduced. However, during my clinical placement at Rumah Sakit Universitas Erlangga, I observed a different approach. Here, IV contrast is routinely used, but oral contrast is not routinely given. For the rectal preparation, air is routinely introduced instead of rectal contrast. Oral contrast and rectal contrast are only given when specifically requested by the doctor. I found this interesting, so I asked one of the radiographers about the reason behind this protocol. I learned that the air helps to distend the bowel and separate the bowel walls, making the bowel easier to visualize on CT. In simple terms, the air can act as a negative contrast because it appears dark on CT, creating a contrast between the bowel lumen and surrounding tissue. This taught me an important lesson. What we learn in class provides us with a strong foundation, but actually, clinical protocols can differ between hospitals, depending on their guidelines, patient conditions, clinical indications, and available resources. Therefore, I should not assume that one protocol applies everywhere. Instead, I need to understand the reason behind each protocol and ask the radiographer when I encounter something different from what I have learned. For improvement, next time, I want to become more confident and independent when operating the CT control panel. I also want to improve my communication skills, especially when there is a language barrier. Most importantly, I want to develop a habit of asking questions and understanding the rationale behind different clinical protocols, rather than simply comparing them with what I learned in class. Overall, this week taught me that clinical learning is not just about applying theory, but also about adapting, communicating, and understand how that theory is applied in the real clinical environment. Thank you for watching.